IVM.
Artificial intelligence, what is that? It sure sounds like science fiction, but it's very much a part of our world today. But most of us lack understanding and a means to use AI to our advantage. Luckily though, Intel's Digital Readiness Program empowers everyone with skill sets, mindsets, and tool sets to use in an AI-fueled world, so you don't end up like me. The Intel AI for Youth program is an initiative that guides today's youth to an understanding of AI, how it is designed, and why it's important today. Intel's been working with the CBSE, Ministry of Education, and the Government of India to empower today's youth to build social impact solutions while demystifying what AI is. How do you take advantage of this? Purchase an Intel Core-powered PC and you get free access to 80 plus hours of immersive and hands-on training about AI. On completion of the program, along with a certificate, you get access to AI toolsets to try put what you learn to good use. Log on to futurebanaowonderful.intel.com. Future Banao Wonderful by bringing home an Intel-powered PC.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like to bring fresh perspectives to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to a brand new episode of All Things Policy. I'm your host, Apurva Kumar. Even though the number of COVID cases in India is declining and our lives are returning back to normalcy, there are a few issues around the pandemic that are either under-researched or not talked about quite often. And one of those issues is mental health during and after the pandemic in India. The subsequent lockdowns, social distancing, isolation, loss of lives and livelihoods, more importantly, all these factors have triggered a mental health epidemic in India. To talk about the topic and some of the policy solutions that can address the issue, I have with me today Aarthi Ratnam. Aarthi is an associate program manager at Takshashila Institution, and she manages the postgraduate program in public policy. Welcome, Aarthi.
Hi, Apurva. Thank you so much for having me.
If you are interested in topics such as these and public health in general and impacts of COVID-19, then Takshashila is running a short course on evidence-based policy making for responding to COVID-19. This is a 4-day course which is stretched over 2 weekends and introduces the participants to the various public policy aspects of managing and recurring COVID-19 waves. The last date to apply for this program is 17th October. The webinars will be conducted on 23rd, 24th, 30th and 31st October. The link to join and enroll for this program is there in the description below. So all right, Aarthi, let's get started. So we'll begin with some of the germane issues, Aarthi, about the issue, and then we'll go into detail.
All right.
So help us understand about the causes of mental health in India, especially in the aftermath of pandemic and subsequent lockdowns. How has pandemic and these lockdowns impacted our lives, and how have they impacted our mental well-being in particular?
Yeah. So before I get into the effect of the pandemic, I just want to talk about the mental health situation in India even before the pandemic. So according to a study in 2019 done by the WHO, nearly 7.5% of the Indian population suffered from mental health disorders. And there are various reasons why this has happened, and also the fact that there isn't enough of data. So we don't even know the true extent of how mental health is in India. So one of the biggest problems is a lack of data. And secondly, there is so much of stigma around mental health. People are afraid of speaking up because of fear of judgment or fact that nobody will understand. And also the reality is that there isn't enough of investment in this sector, and there aren't enough of healthcare professionals in this field. The reality is that for every 100,000 people, there is only one psychiatrist. So with this backdrop, if you look at the effect of the pandemic, it's obviously much, much worse than what you can imagine. So some of the factors could be because of fear. A lot of healthcare professionals have labeled it as the Fearodemic. It could be the fear of getting COVID, the fear of losing a loved one because of COVID, or just the general fear of the unknown and just so much uncertainty. The second factor that could affect mental health at a time like this is unemployment. As you know, a lot of people have lost their jobs, and it's difficult to support a family when you lose your job, and there's so much of financial instability. And third could be social isolation and loneliness, because we've all spent so much of time indoors. The lack of human contact or any sort of communication has obviously affected a lot of people's mental health. And finally, another factor would be stress, especially for healthcare professionals. They're overworked, and a lot of them are underpaid as well. So just that extra burden at a time like this is also detrimental to mental health.
Right, Aarthi. I think it's the phrase that you have used is quite pertinent and interesting. Fearodemic. I just wanted to understand: has this pandemic affected vulnerable communities differently? And when I say vulnerable communities, I'm referring to women and children. Help us understand how this isolation and the fear has affected women and children, especially women who were not supposed to step out of their house, because some of the research says that the instances of domestic violence has increased. So could you just shed some light on this aspect?
Yeah, absolutely. So according to a study done by the National Commission of Women, India recorded a 2.5 time increase in domestic violence during the first half of 2020. And this was during the first lockdown. So the number of cases of domestic violence has significantly increased during the lockdown last year as well as this year. So it certainly affected women and children in that sense. Also, women are more likely to have lost their jobs. During the first lockdown, only 7% of men lost their jobs compared to 47% of women. So the lockdown has also affected women in terms of job insecurity. And finally, even in terms of the number of women who have registered to get a vaccine, in rural India, only 17% more men have been partially or fully vaccinated compared to women. And this could be because of so many myths that are going around. The fact that the vaccine could affect female fertility, or even the fact that women are not allowed to go out on their own and they require a male companion. So the lockdown has certainly affected women in a lot of ways. And coming to children, in under normal circumstances in itself, the reality is that 1 in 4 children within the age group of 13 to 15 in India suffer from depression. And nearly 50% of mental health disorders develop by the age of 14. And at a time like this, when children are spending so much more time at home and not understanding the true effect of the pandemic, of course, it's going to affect their mental health so much more. And for the rural population, it's even harder because according to a UN Women data report that was published, 67% of parents who were surveyed were reluctant to send their girl childs back to school and instead resorted to child marriage because it just saved costs for them. So clearly you can see that the pandemic has affected certain communities more than the others.
Right, and Aarthi, it's like quite alarming. The data and the statistics that you are quoting is quite alarming, because before pandemic, the infrastructure, the care providers for mental health is quite limited, as you pointed out in your opening remark in India. And post pandemic or during the pandemic, the situation has worsened. So our public health systems or health systems in general, they have a lot to catch up when it comes to mental health issues.
Definitely.
Great. In the article that you have written, solutions that can address the mental health crisis in India, and especially in the context of a child's mental health,
Yeah.
you've talked about building coalitions. Could
Yeah.
you explain what these coalitions look like?
Yeah. So it's not, I strongly believe that it's not enough just to have welfare schemes done by the government. I think it requires a more holistic environment. And I think that begins with including mental health as part of an academic curriculum at schools. Because children spend so much of time at school, I think to have that literacy about mental health would be extremely beneficial for children, because that way you can grow up from a young age being comfortable to talk about mental health. And that way you can prevent any issues from developing, before it becomes a bigger issue. So I think one of the first coalitions should be with academic institutions. Secondly, I think more research needs to be done. There is a staggering lack of data. And because of that, there just doesn't seem to be a problem, because there isn't enough of data to back up the fact that mental health is an issue in India. So I think the second coalition should be with research institutions. And third, I think primary care providers. I think there definitely should be more people who get more involved in the sector, even in terms of like people getting into psychiatry or psychology or counseling. I think we definitely need more people involved in this sector, because that way you can destigmatize conversations around mental health. And finally, I think you need to set up more community support groups. It can be with even amongst friends and family, just to have these conversations more openly should be the first step. I think instead of looking at it at a larger scale on a national level, I think every single conversation that you have individually will make all the difference.
Right. Aarthi, we will talk about some possible policy solutions and interventions, but we have to take a short break and we will talk about these issues after the break.
Namaste, this is Cyrus Brocha. I am part of the government cancel culture program to remove rubbish off all the different streams available. So what we have is all the collected rubbish we put together on our show. It's called Cyrus Says. It's on IVM podcast. You have to watch it and listen to it. It's on our app. It's on our website. It's on the YouTube channel. It's on Facebook. There are many different ways. Don't bother me and ask me how. You have to find out. We talk to different personalities. Many of them are known. Some are just people we meet downstairs and invite them up for chai. But the point is, it's fun and it's very therapeutic. So please join in and listen to Cyrus Says.
All right, welcome back. So Aarthi, while you were talking about coalitions and some of your, interventions, I couldn't sort of stop and think about what Dr. Vikram Patel has sort of written few years ago and has been written over the past few years. And he talks about, mental health in primary care setup, and he talks about task sharing, in which he advocates that there has to be a sort of a big cadre of people who can address mental health issues at community level. And if the person or the community needs specialized interventions, then they can be referred to hospitals and other care centers. And as promised, we in this part of the podcast, we will talk about policy solutions and interventions.
Yeah.
So, Aarthi, what, according to you, are some of the policy solutions, interventions, both at government level or at civil society organization level or civil society level that can help solve this problem?
Okay, so one thing that caught my eye and I thought was a very good initiative was done by the Human Resource and Development Ministry. They launched a virtual initiative called Pragatya, which basically gives guidelines on online class operations for children. So it talks about how many hours children should have for online education. I think this is very important because I don't know if people have heard of the phrase Zoom exhaustion, but it does become quite challenging to spend hours in front of a screen. So this sort of initiative sort of regularizes how much time a child can spend online. That way it prevents any sort of exhaustion and ensures that they're gaining maximum from the time that they spend virtually. So I think this is a very good initiative. But also in terms of the amount of budget allocation on a national level, I definitely do think it needs to be increased, because despite a 7% rise in the total healthcare budget this year, there has been no increase in the allocation for the National Mental Health Program. So I think that's an area that definitely needs to be addressed.
Okay, can you suggest one of the successful policy interventions or any case studies that come to your mind that have helped solve this problem and ensure mental well-being of the community?
I think more than a national policy, I am more appreciative of smaller initiatives. And I think one of the few good things the pandemic has done it's led to an increase in the number of people speaking about mental health, the number of people seeking help. So the number of helpline services has increased, the number of support groups has increased, and there's just been an overall increase in an awareness about mental health issues. And I think that's one. And I don't think that really is a large-scale policy, but I'm very appreciative of the fact that individuals are taking that initiative to make a change at a key time like this. And I think, like I said, individual efforts, smaller conversations will in turn start adding up to make a difference on a larger scale.
Right, Aarthi. My last question to you is this, and it's quite a sort of a broad, open-ended question that how can we ensure that we as individuals or our society or our communities are sensitive enough to understand these issues? Because in your opening remark, you talk about stigmatization, and that's a major problem that acts as a hindrance to this issue. How can we sensitize our communities and a society?
I think the first step would just be to talk about it and to be a good listener at the end of the day. And it's so important that we're so used to trying to give people solutions, trying to give people an answer. But I think it's more important to just listen, because at the end of the day, I think that's what people want more, especially at a time like this when we're so uncertain about the future, about how things are going to be. I think it's really important to just be able to listen to the other person and let them know that you're there to be a supportive friend or as a supportive figure. I think that's the most important thing. And in turn, these sort of conversations will make all the difference. So I think it comes down to each of us to just be more attentive and be more sensitive to what the other person is going through.
Okay, thanks, Aarthi. And I think with that, we have come to an end of this conversation. Thank you so much, Aarthi. It was lovely talking to you and listening about this topic and your ideas. And thank you, listeners, for tuning in. And we will be back with another episode of All Things Policy.
Thank you.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
Hey everybody, it's been another great week on the IVM Podcast Network. On Cyrus is joined by writer-director Faraz Arif Ansari to talk about their critically acclaimed short films, Sisak, Siberia, and the recent hit Shir Korma. On The Habit Coach, Ashton introduces us to Avinash BR, co-founder of Deep Rooted Company, and his take on the quality of the food and supply chain in India and current trends in the farming sector. On Naan Curry, Sadaf and Archit talk about the humble potato, right from its origin and trade history to the various ways it can be used in dishes and its health benefits. On All Things Policy, Aditya Ramanathan joins Aditya Parekh to discuss the UK's first ever national space strategy document and the lessons it may hold for India. And on Say No to Drama, Chetna slices through the drama of bad boss behavior and shares what it takes to be a good boss. Do follow us on social media. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And remember, if you're enjoying this show or any of our others for that matter, please do tell a friend. We really appreciate you spreading this. Word of mouth helps a lot. And finally, this week, we'd like to thank our sponsors, Cred, Bank of Baroda, Quarter, CoinSwitch, Kuber, Slay Coffee, and Intel. We really appreciate the support.
Come learn and experience the ABCDs of being queer with me, Shunetro,
and me, Farhad,
on our show Gay BCD.
The two of us take you through our stories and experiences of being gay men in the city of Mumbai and have candid
and sometimes downright scandalous
conversations about sexuality, gay culture, and everything in between.
Catch new episodes of Gay BCD every Tuesday, on the IVM Podcast website, app, or wherever you get